What are the causes of high estrogen level? In people assigned female at birth, those people which are assigned to be female at birth, estrogen help initiate sexual development along with progesterone, regulate menstrual cycle, and affect the entire reproductive system. In people assigned male at birth, estrogen, its important role is just sexual function. What are the causes of high estrogen level? High estrogen level may develop naturally in certain conditions, which I'll explain. Certain medication and health condition may cause high estrogen level as well. Hormone imbalances like PCOS, it's a situation with very high estrogen level. HRT, which is hormone replacement therapy. During IVF cycle, estrogen level, because of a lot of follicles which are stimulated, tend to be very high. And estrogen producing tumor as well, that you should also bear in mind, something like ovarian cancer. Symptoms of excessive estrogen in females. What is it that will tell you as a female or a woman that I'm producing a lot of estrogen? Breast tenderness, headache, weight gain, light and heavy menstruation, premenstrual syndrome, fibrocystic lump in the breast, fibroids itself, they tend to grow fast in people with high estrogen level, fatigue, decrease in sexual drive, depression, and anxiety. Symptom of high estrogen in males is very important as well to go through. Infertility. Estrogen impaired the formation, the morphology, even the concentration of sperm. It causes what you call gynecomastia, which is actually enlarge of breast in males, and it also causes what we call erectile dysfunction, which is ED. We know we have three types of estrogen, which is estradiol, which is primary female female estrogen, and estrone, which is minor really, and then estradiol. Both of them, they are minor; they're not playing a major important part. But estradiol is the end product, which is very effective in females. What is the treatment of condition causing high estrogen level in females? Firstly, we look at medication that can be conditioned like polycystic ovarian syndrome. Hormonal contraception may control the situation. Metformin and even letrozole to achieve pregnancy, and IVF or IUI in this group of patients. ART as well, reduction in those who are on hormone replacement therapy. And when you measure the level of estrogen, find out is very high, then you reduce the dose of a tablet. Surgery, most common cancer-related condition like ovarian cancer, you may need to do surgery or even oophorectomy. Estrogen level which are high can be controlled by diet, especially in people with the polycystic ovarian syndrome. That may be avoiding processed food, increase the plant-based food, the whole grains, and even fiber in your diet. Lifestyle is also important to change, which may actually regulate your estrogen level by doing regular exercise, weight loss if you are overweight, avoid alcohol, and stop smoking. Conditions related to high estrogen level. It's very important that if you have got a chronic exposure or a long exposure to high estrogen level, you have got high risk of the following condition. One is breast cancer, ovarian cancer, endometrial cancer, blood clots, and stroke. Therefore, it's very important that you understand and that estrogen level which are very high actually can be disastrous or can cause very bad conditions, as we mentioned, breast cancer in women or even males, ovarian cancer, endometrial cancer, blood clots, and even stroke. Thank you.